Hey there, it's Andre, the Impulsive Thinker. Today I have Dr. Gurdeep Parhar. He's a medical director at the Adult ADHD Center. And today we're going to talk about substance use disorder and ADHD. And again, Dr. Parhar, thanks again for joining us and sharing with your expertise and exposure on this topic, which I think is an important one to discuss during October ADHD Awareness Month. Thanks for being on.
Yes, yeah, and thank you, Andre. And I think sometimes people don't understand that certainly we're talking about substance use and the opiate crisis from coast to coast to coast, but people don't understand that there is a considerable amount of overlap with ADHD. So it's important that we talk about it in the context of ADHD as well.
Good. Before we get into this, what is your background and what is Adult ADHD Center? Why did you start the Adult ADHD Center?
Thanks, Andre. So my background is I was trained as a family physician, but my practice had always been focused on people who have disabilities. So they had some sort of impairments or disabilities, whether they're visible ones, so physical disabilities in wheelchairs and some sort of traumas, work injuries, car accidents, but also invisible disabilities like psychological conditions, brain trauma, and others. And over time, I had this practice, but what I didn't understand was that people with ADHD were not being served well, weren't being diagnosed, weren't being treated. So when I first saw my first patient about 6 years ago, I didn't realize there was no place to send him. And then we decided we needed to set up a center to help people like this and realized that we had uncovered a huge need. So now we offer assessment services in every province and territory in Canada so that once people have clarified whether they have ADHD or not, we can get them onto a treatment journey that will help them lead a better life.
And then with your centers across Canada and every province and I believe almost every territory, it's readily more available to the adult community a lot more than it has been even a couple of years ago.
Absolutely. I think the previous model that everybody struggled with was that you could see a psychologist, and I have a lot of respect for my psychologist colleagues, but a lot of times their assessments are 1 to 2 days, costing anywhere from $3,500 to $4,500. And frankly, Andre, a lot of people couldn't afford that, right?
Yeah.
And so our goal was to keep that price point very low, let people access the services so they can get on with treatment.
Well, thank you. Thanks again for that. And it's a great service. Let's get into it. Substance use disorder, as it's been known in the past as substance abuse, just so people can tie the two together, but it's substance use disorder. Can you give us a clinical or a medical definition or phrase around it? Because I think there's a lot of definitions out there with the general public.
Yeah, and this is important, Andre. And as you said, we have used different terms for this in the past, and just so that people and your listeners can resonate with what those previous terms were. This is where somebody would have said in the past, "I'm an addict," or "I'm addicted to something," or somebody misuses or abuses drugs. So these are the kinds of terms we were using in the past. We've used the new term that we work with now is called substance use disorder, and it's in our diagnostic manual where we have psychiatric conditions because we recognize it as a psychiatric condition. And the kinds of symptoms that someone would have, there's a number of them, and I'm going to sort of list them off. One is that the person with the substance use disorder starts taking the substance, whatever substance it is, cocaine, heroin, alcohol, nicotine. They start using that substance in larger and larger amounts and for longer periods of time than they're meant to be used. They want to cut down, that's one. Second is that they want to cut down or stop using the substance, but they can't, right? So a lot of times people with a substance use disorder will say, I need to drink less, or I need to use less cocaine, or I need to smoke less, but they can't. So that's a symptom of having a substance use disorder. Spending a lot of time using, or recovering from the use of the substance, right? And so I had a colleague once say, my kids know I love them when I spend time with them and when I spend money on them. It's kind of a funny thing to say, but it's the same idea with the substance use disorder. If you're spending a lot of your resources, your money, or your time trying to get that substance, that means that you have a problem, right? Cravings and urges to use the substance. So craving, and you can't control that craving, and you have to find that substance. Not managing to do what you should be doing at work, at home, or at school. This goes into the impact part. And we talk about this with depression. We talk about it with ADHD. Everybody's allowed to be a bit forgetful. Everybody's allowed to be a bit sad. Where it becomes a disorder is where it's impacting your function, whether it be at school, at work, or at home. It's impacting relationships, your intimate partner relationship, relationships at work, your friends, your family, that you're giving up social and occupational activities because of the substance use. You'd rather not go out with your friends or hang out with your family because you'd rather be using that substance by yourself or with other people that are sort of using the substance as well. You want to use the substance again and again, even though it's putting your health and your family at risk. Continuing to use the substance, even though you understand that it's making you and people around you angry and upset. Needing more and more of the substance is that you could have gotten away with one or two, they call them bumps of cocaine, or one or two drinks, and now you're needing 4 or 5 drinks, or you're needing more bumps of cocaine. And the last one is more of a medical symptom, which is that you start to go into withdrawal when you don't have that substance. You physically feel unwell, you emotionally feel unwell, or you even feel pain. So those, I've listed a lot of them there. There's about 11 different criteria. And I think the main thing to understand is that it's how much it impacts you. So we used to, and we still do, for example, with alcohol and other things, we ask people, how much do you drink? And we want to know, as doctors and as healthcare people, we want to know. But it's not so much the amount as how much of a dysfunction it's causing, right? So somebody could only drink, say, once a year, but if they drink excessively that once a year, and that causes all sorts of problems for the people around them, that's still an alcohol problem. That's still a substance use problem.
So it's not about the amount; it's the frequency of
It's
use.
it can be about the amount, and it can be about the frequency. Frequency means how often you use it. But the bigger issue is how much it's impacting your health, your work, your schooling, your family life, your finances. That to me is the bigger way to judge the severity of a substance use condition, is how much of an impact it's having on your existence.
So a bit of my experience, how does dependency on that substance about making, like for a while there with alcohol, I was depending on that alcohol to kind of get me through at the end of a stressful day. Was kind of like, oh, nice little drink to just say, oh, to wash things away. Um, I was dependent on that for a while. I wasn't a raging, because I think the other thing too, I want to discuss a bit more before we go to, I guess, to that is there's substance use disorder. It doesn't mean you're just full out drunk, stoned, full out. There's a spectrum, right? You can still have a problem even if you don't fall over drunk or fall over high.
Absolutely. And some of the people, I was going to say a good number of people who have a substance would meet the criteria for having substance use disorder are probably functioning what we would say fine, because they're able to even disguise it or hide it, or it happens so infrequently that people don't notice. But that doesn't mean that they don't have a problem. And you're right, this isn't this person who's sort of hung over all the time, or the person who is arrested because they've tried to buy something on the street. This can be people who otherwise look like they're high functioning and regular members of society. They too could have a significant substance use disorder. So don't let how they're appearing and how their outward faces fool you, because they could be harboring a significant substance use problem underneath that.
I think that's a really great point that you brought out too. I think for us high achieving ADHD entrepreneurs, we've, a lot of us have been told you can't have ADHD because you're doing well, but we can be high functioning and still suffer from substance abuse disorder, is what I heard.
For sure. And I
Okay.
remember one patient that came into me early when we set up the ADHD center. And I won't name his profession just to keep him anonymous, but he, made a fair amount of money. And he came in and he told me that he was doing 2 to 3 bumps of cocaine a day. And so we calculated out, actually I didn't, his partner did, who was with him at the visit. And she calculated out that he was spending $25,000 to $30,000 a month on cocaine. And later when we did the ADHD assessment, we found that he had very, very significant ADHD symptoms. And so I said to him, I said, what happens after you use cocaine? And he says, Doc, it's kind of weird. He says, I just feel relaxed and I go to sleep. And so my inside cynical mind said, that seems like a big waste of cocaine. Now, Andre, I've never used cocaine, but I would imagine that if I use cocaine, I'd probably be crawling up some wall where I'd get really, really high strung. That's what cocaine with people, because it's a stimulant. Now, for people with ADHD, remember their dopamine levels and their norepinephrine levels are low. So they're starting lower than baseline. So when they then use, especially a stimulant recreationally, it brings them up to what everybody else might even have as quote unquote normal level of a stimulant or of a dopamine level, right? So
Yeah.
not surprisingly, this guy was actually just using the cocaine and he felt relaxed. He was not overexcited, right? So where I'm going with this is that the thinking and the interaction between ADHD and substance use disorders is actually there's a biological basis for it. We think it's the dopamine deficiency that people with ADHD then want to use substances. And you have to remember the other part of ADHD is what? Impulsive behaviors,
Yeah.
right? And so when you're using a substance, it's typically not because you well thought it out well. You could have. Most people do substances that they regret later because they're acting impulsively. And that's a part of the ADHD condition. So what's interesting is that we are understanding that a lot of people who have a substance use disorder actually have an underlying, undiagnosed, untreated ADHD condition. In fact, many of us are advocating at a provincial and national level to say to the government and people who control national funding is you think you're going to address the opiate crisis. We're going to tell you that you're not going to succeed at that until you also address the ADHD crisis, which is that we need funding into proper diagnosis and treatment of ADHD because a big percentage of people who have or dealing with an opiate problem are undiagnosed, untreated ADHD people. And until you address the ADHD, you're going to continue having an opiate problem.
Yeah, and like your story there about the cocaine use there, it makes a lot of sense, especially with the research I've been learning. And we talked about this when you put someone with ADHD on stimulants, the like prescribed stimulants, their brain slows down, while a non-nerd, like a non-ADHD brain would just go gets high strung, right?
Yeah.
And that makes sense. Like for me, and to alcohol was an energy release. Being hyperactive, being forced to sit down all the time, be quiet, especially university, I think that was a way to just drink my face off and dance all night just to burn off that energy. And there was actually a way I think was also to cover up, there goes crazy Andre, he's always drunk. So my ADHD personality was better accepted.
Yeah, for
And
sure. And two quick interesting stories that will explain this point. There was a young fellow that came in once, and he was chewing throughout his ADHD assessment. And I said, that gum must be good. That gum must be really good. And he said to me, he goes, no, it doesn't taste very good. I said, what is it? And he said, it's Nicorette gum. I said, are you trying to stop smoking? He says, no, I've never smoked. He says, but I find I can't listen unless I'm chewing the Nicorette gum.
Mhm.
So here's the thing, Andre. People think that people who smoke think that they're addicted to or they're dependent on that they crave the nicotine. They're not craving the nicotine. What they're craving is what the nicotine does to the brain, which is nicotine increases the brain's dopamine levels. And it's the dopamine, the pleasure center, the pleasure neurotransmitter that makes you want to crave the nicotine because nicotine increases dopamine. So this young fellow was chewing nicotine gum, not because, and I've never had it, but I've got friends who've tried to stop smoking and they'll tell you Nicorette gum doesn't taste very good. So
No,
this
it
guy was
doesn't.
forcing himself to chew Nicorette gum because that was actually increasing his nicotine, which was then increasing his dopamine levels so he could concentrate. So he, in fact, he was treating his ADHD by chewing nicotine. And the other story was a middle-aged woman, a professor at a university. She said, doctor, I need help. And she had taken herself off her ADHD meds because she thought she was fine. I said, what happened? At the age of 41, Andre, her teenage kids and her husband found her in the backyard chain smoking. She'd never smoked before. And somebody at the university sort of said, here, have a puff. And she found out she could get all her papers marked,
Yeah.
all
Yeah.
her students. And so she was in her backyard chain smoking so that she could come into the house and then get the marking done. And so just to tell you that there is this biological connection between the dopamine deficiency in ADHD and the substances. So whether it's alcohol or whether it's nicotine and smoking or opiate, that it does do something to the opiate deficiency. And that's why there's this tight connection.
Well, it's interesting with the nicotine. I didn't realize it increased dopamine because I did smoke for a long time myself. And like I even put a note down here. It's like I realized after a while, once I got diagnosed, was my smoking was actually it was dependent. I was dependent on the smoking because it was a self-soothing mechanism. My
Right.
psychiatrist says it's almost meditative. You know, drag hand down, drag, hang down, and you just focus on that. But also for me, it was a massive transition tool being stuck in an office, engineering office all the time.
Mm.
I will get this done. I can have my smoke. Then I come back and start the new thing. I wouldn't get my smoke until I got something done. And so there's actually my transition time. Then I really struggled when I quit smoking. Um, Cold turkey, of course, all or nothing, right? And I never took breaks. The whole day would just be blurred as one because of those transition breaks. And but I do know as a fact today, if I ever have one drag of a cigarette, I'm back to a pack a day immediately. I just have
Yeah.
this sense, and I just know that. And I even cut out cigars and anything related to inhaling. So this is really good because we got a lot of good examples here. Is we were actually self-medicating ourselves unknowingly. We were fixing our own problems because no one else understood it or no one understood it. And I think that's a key distinction. Is that like that would be substance use disorder with ADHD people? Is it more about self-medicating to
A,
get,
a,
your brain under control?
a big part of it is, and it's that rush, right? It's also risk taking. It's
Mm-hmm.
doing something a little bit cutting edge. Just to move away from a substance use disorder for a moment, why do people who have ADHD drive erratically or do weekend warrior stuff or have road rage? It's because that spikes up the dopamine, right? So it's a
Mm-hmm.
craving, that pleasure center being hit, and substances will do that. Now, what we understand is that people with ADHD, what substances do they use? The same ones that people without ADHD use: alcohol, nicotine, cannabis, cocaine, and all these types of things. Now, here's one thing. I don't get upset very much, Andre. I think I'm a pretty calm guy. But one thing that makes me really angry and upset are people who with ADHD who have had a past history of substance use. So in their youth, they used cocaine or they used
Mm-hmm.
alcohol excessively or whatever. They go to see a doctor and the doctor says, I'm not going to treat your ADHD with a stimulant because you have a past history of substance use, right?
Right.
That, that makes me so angry because ultimately, first of all, they could be in remission and that substance use is history, or maybe they're still struggling with it. But the point is, how are you going to improve their substance use disorder or their ADHD unless you treat it? And so what we're understanding now is, and you said this earlier in our session, is that you need to treat the ADHD to help people also recover from their substance use. To say you're not going to treat the ADHD because you use cocaine when you were
Mm-hmm.
whatever 21 is actually really, really frustrating because how are we going to help people with ADHD who've had a past history? In fact, you need to treat both things.
Right. And a doctor saying that to a patient, that's just the traditional thinking and learning, right? Right. Stimulants is a controlled substance, therefore highly addictive to the non-ADHD brain. So how can I communicate that to a doctor that believes that or understands that because of their limited exposure to ADHD or even substance use disorder? How can I communicate to them, hey, if my ADHD is treated, the substance use could be better?
I think by doing what you've just done there, and certainly getting people like myself and others to show them studies that, you know what, you're actually doing more. I had to argue with a doctor, Andre, not long ago, where they said, I can't believe you gave a stimulant medication to a patient who has a past history of, I think it was MDMA or ecstasy use in the past or crystal meth. And I said, and I said, actually, it's the other way. It's that how am I going to keep them in remission? How am I going to stop them from going back to their crystal meth if I don't treat their ADHD? I said, you should be looking at it the other way around, is I'm going to keep my patient in their substance use under control by treating their ADHD. Not that I'm putting them at higher risk by treating their ADHD.
Right. Well, I'm processing so much right now, like especially the craving for dopamine hits. Is yeah, I'm starting to get a little not information overload, processing information overload. So, what in a way is the ADHD brain more susceptible to addiction, or sorry if I'm using the wrong term, or substance use, or is it more of our past experiences, or is it? I guess I'm just going to make it simple. A lot of stuff I've been reading, being told, is the ADHD brain is a lot more addictive, has more of a capability to be addicted to things than non-ADHD brains. And I find that's not necessarily true or valid. Am I
No, you're right on. Your understanding is exactly that. So we know that untreated ADHD, actually people whose ADHD is undiagnosed, untreated, they're at much higher risk for having a substance use disorder. But here's the important thing, and again, trying to paint a positive light. We know that if you take people who don't have ADHD and compare them to people who do have ADHD, people with ADHD, and there was a 4-year study, are 75% more likely to have a substance use problem. But here's the cool part is that if you treat those people who have a substance use problem and ADHD, and you treat their ADHD, that their likelihood of staying with the substance use problems drops from 75% to 25%, right? So if you treat somebody, if somebody has both, they have substance use problem and they have ADHD, you treat the ADHD, the likelihood that their substance use problem will also improve is significant, right? And but your initial question, are people with ADHD more likely to have a substance use problem? Absolutely.
More,
Yeah.
is it more of an undiagnosed ADHD?
Yes, a bit of both, or it could be an undiagnosed or untreated ADHD. If you think about it, if there's somebody who goes to Narcotics Anonymous, or they're in a detox center, if
Mhm.
somebody was down with this population of people who are struggling with substances and actually do a diagnostic test for ADHD, I think you'd find a really high percentage of them actually have ADHD. Just like we know that a lot of people that are in custody, which is the right term for people who are in prison, that people in custody, we know that 35 to 40% of people in prison right now would meet the criteria for ADHD. Why does that make sense? They did something that they regret that was impulsive, and they broke the law,
Yeah.
right?
So is it fair to say that substance use um, disorder with ADHD brains is more about self-medic? It's not only, sorry, let me restart that one. ADHD brain, there's two different substance use disorder. One is for self-medicating or medicating the symptoms, or you actually truly are starting to become abusing or using the substance for the negative reasons, but not attributed to ADHD.
Under that's a really nice, clear way of sort of organizing your thoughts around this. So one is that people with ADHD are self-medicating with a substance, particularly a stimulant they get recreationally, whether it's crystal meth, whether it's cocaine, with a recreational stimulant, because that helps their ADHD and they can function better. I hear of middle-aged moms and dads at home will say, I can get my laundry done, I can get all this my work done at work if I use a little bit of cocaine. Those people are using the recreational stimulant to treat their ADHD, which can be problematic on so many different levels.
Correct.
Then there are people who actually have ADHD, and because of that, they're using the substance not to function better, but as a true, we can call it recreational, but in an abusive way, which then leads to harm, and they're not actually functioning better with that substance. They're actually harming themselves in how they function. And the danger is you could be in one and flip into the other group pretty easily, right?
Wow, this is fantastic. We got a couple minutes here, Dr. Parhar. You said something earlier, and it was about craving. And I got a note here from one of my experiences. And is there a difference between craving a substance versus wanting a substance?
I think, yeah, that's a great discussion to have. I think when you want something, you can probably, I think that the inference is that with wanting something, you can say, okay, I want it, but it's better if I don't have it right now. Craving implies that you can't control that urge, right?
Right.
So
Yeah.
take it to hunger, right? I'm sitting right now and I could eat a banana split, right? But if I was starving and this banana split was, I know, in my fridge, then I crave it knowing that,
Yeah.
and I'm going to eat that darn thing because I'm craving it now, but I'm also starving. I'm hungry, right? And so craving is, when we say craving, we're implying that we're about to give into it, that it's a really strong emotion. Whereas wanting, we're implying that we can control it a bit more easily. Yeah.
Yeah, because like for me, the last experience I had, like alcohol has been an up and down thing for me. I was never a full out, I was definitely a high functioning, but there was a lot of self-medicating with alcohol. So I quit, stopped, take long breaks. And last year, something happened personally that I ended up being drunk almost every day for 3 weeks straight. And I decided I'm going to take another month break, no alcohol for a month. Then when that month came up, I went out and drank, and I was in a different city in a different province. And once the people I was socializing with, they went to bed and all that, I ended up going out with a bunch of locals in town. And I don't remember getting to the hotel. I don't remember the mess I made in the hotel. And I got scared shitless. Like I was scared. I thought someone slipped me something. And then I realized at that point now, I actually, when I decided to take that 1 month off, I was actually counting down the days to that next drink. And I didn't realize that till after. So I've had a couple, it runs highly out. I guess it'd be another conversation another day if it's hereditary, but the way I was raised, if it runs in the family, you're very prone to it. And I was always careful that I took a lot of breaks. But for this one here, I'm like, I know I was starting to crave a drink for anything. And my new rule now was once I no longer crave a drink, when things get tough, crazy, or stressful for 3 months, then I'll have a drink. But once that craving, I feel that craving, that 3 months gets reset every time. And I think I got very lucky with that experience. I didn't get in a real bad situation, but it's not something to get. It's tough. It's tough to break out of the cycle of substance abuse. I've got quite a few good friends that have suffered and are still suffering, and it's very difficult. And for the listener here, and I really appreciate you coming on to talk to us about this, Dr. Parhar, because I think it's something we need to understand. And your point about you can still be high functioning and still suffer from substance use, I think it's so socially accepted. I don't think we're aware that we actually can have a problem because we're still high functioning. And again, impairment to daily functioning, relationships, that's a disorder. For me, it was like, not wanting to be around the family, spending a lot of money. And the biggest, there's two big ones here. The craving for dopamine hit. I never realized till you put it together, a bunch of different points connected. It's all about that dopamine hit is the actual addiction, if I recall correctly. So once you get to it, that's what you want. And then once you have it, well, you're already in the process and you keep going. And substance use disorder can be for self-medicating purposes of the ADHD brain, or you can be using it for an escape or recreational use that has negative effects. So there's two sides to the coin. We're not saying if you're using it for medical condition for self-medication purposes that it's acceptable. Again, it comes down to impairment to your daily functioning. But these are all things we need to be aware of. The ADHD brain can enjoy these addictive, these substances, and we got to be quite aware of, and very costly, and destroying businesses, relationships, and all that. So, and to you, I'd like for you, the listener, what I want you to take away is that, substance use disorder is I would say it's a little more prevalent with the ADHD brain because of that requirement for, or internal drive to get a dopamine hit or self-medicating. Let's be careful here. We're high functioning individuals. We can highly function in today's world under the effects of these substances, but there's a line where it becomes a problem and affects things. So what I want to ask you is, please take a look at if you're using substances. I'm not accusing or implying that everyone uses it, but if you are drinking, smoking, or whatnot, is it a safe and level, and it's not disrupting your day? Any last thoughts, Dr. Parhar? Because you've given us a hell of a lot here.
First, Andre, my biggest and most important thought is thank you for sharing your own experience. I think that's what makes the Impulsive Thinker such a popular and such a successful program, is you're not hesitant to share your own experiences, as difficult as it is and was and is to share. So thank you for that. And the main message I think I want to leave people is that if you're dealing with a substance use issue, please get some help. Whether it's the ADHD component, whether it's a substance use component on its own, there certainly is a lot of opportunities to improve. And we don't want you to be in a situation where things end up happening because you didn't get it properly addressed. And do get the help that you need. There is definitely a way out of this, and life can be so much better.
And there's nothing wrong with getting help. And what you do tomorrow is more important to me than what you've done in the past.
Yes.
So thanks again, Dr. Parhar. You can find him at the Adult ADHD Center. Information will be in the show notes for you. Thanks again, sir.
Great. Take care. And thank you for having me, Andrew.
Anytime. And to you, the listener, thanks again for listening.